POSIStation. And Tom, tell us about what you saw and what you invented up there in Canada.
Hi, Vic. Yeah, being a medical equipment manufacturer, I've been paying close attention to what's going on with the coronavirus for, since the middle of January or so. And we just saw that, especially in Italy, that, there are a lot of healthcare people being infected by this, and due to its high infectivity, both through aerosol and droplet contamination. And I became concerned, and I just came up with a way to help protect frontline workers who are actually doing the testing from being infected with this
well,
virus.
And the issue is there's not enough gloves and masks and equipment to go around, really.
Yeah, and that's exactly right. And so this invention actually protects the healthcare worker and preserves PPE and reduces the number of people you need. So, for example, locally, they have the drive-through testing here, and each drive-through station would say do 25 swabs a day. You have to make appointments to go to them and so on. There's 4 people there outside in the freezing cold. It's below zero today, with all kinds of PPE, and actually going to a vehicle with someone who may be infected. When you understand how the virus works, if you cough or sneeze, you're putting virus particles in the air, not just through droplets, but through aerosol that float around. And so when you pull up in the car and open the window, you effectively have a chimney of the virus coming out. And as long as they have proper PPE, they'll be fine. But I think the best solution was to just take that danger away completely by using positive pressure and positive airflow.
So explain to me. We talked before, sort of in the pre-planning call. You spent a week or 10 days, sort of almost working around the clock trying to solve this. How did you approach it, and what did you end up doing?
Well, I'll put up the concept diagram.
Okay. Yeah.
And basically, this was an idea 2 weeks ago. And it took 10 days, day and night, till midnight every night. And we actually built one of these things and tested it and went through many revisions. And so you can see the device behind me there.
Yeah, right.
Basically, it's a very simple concept. So, a lot of hospitals have positive and negative pressure rooms. They use positive pressure rooms to protect medical staff from virus coming in.
Oh, yeah. In the hospital facility, that's pretty widespread. Yeah.
Oh, absolutely. And so we're just taking that and doing something a little unconventional and putting it out in a shipping container. So we have a shipping container with an 8x12 insulated, heated area. Well, we're in the north. And what we're doing is pumping filtered air from outside into the unit, so it's under positive pressure. So we get the same level of protection you get in a positive pressure situation in a building. But the other aspect of it is the flow. So to actually do the swab, you can't be in a closed room. You actually have to have access to the patient.
Right.
And so we use positive pressure flow, or positive air flow, in a certain number of square inches of an opening where the doctor can actually swab the patient and be protected from any contamination through aerosol needs.
Okay, so just walk me through it. The patient comes into that front area there.
Yeah.
It looks like, and there's 2 windows. There's the consulting window and assessment window. They then open up the assessment window, and air's flowing out, but the doctor can interact with the patient, and the air is moving away from them. Is that right?
That's right. So if you look at the front 8 feet of the shipping container, it's wide open, so that the patient is effectively outside. They're sheltered, but they're essentially outside. And air is your friend here. You want natural air changes to remove the aerosol virus from there. And then the medical staff inside are protected, because there's no way that air is going to get inside that protected area. And then when the doctor opens up the window to do the swab, the airflow in there through that partition increases greatly. And there's we've been doing testing and wind load testing and all these sorts of things to make sure that there's no chance of any aerosol contamination getting back into the medical side.
Yeah.
So it's compared to a drive-up testing, it's a much safer environment. It saves a lot of PPE. There's no need for bunny suits in here, and you still want to wear a face shield and a mask when you're doing the swabs and so on. But the person behind the assessment window, which is where you would get the patient information, question them, and these sorts of things, would need virtually no protection. The doctor in front of the assessment window, of course, would need some sort of protection.
Yeah, right. Okay, and so talk to me about your story. Like, how did you think of this, and what's your background to be able to throw this together? It's pretty innovative, out of a shipping container and a bunch of other materials, I guess, in your shop there. How'd you do that?
Yeah, well, I've been in manufacturing for 34 years, so I've started, been key in starting about 20 companies in manufacturing. I only own a few myself, but about 12 years ago, I started a foundation, the Fortin Foundation. And what we do is we encourage young engineers to go down the entrepreneurial path as far as designing and building things. And the foundation has built the facility we're in now, which is a full-on product development center, unique in the world, really. It has all the standard things you find in these
And
types of.
it's up in Ontario, right?
Yeah, Northern Ontario, Canada. So what we have here is,
I'll come visit you in July. It's a little chilly for me there right now.
Sure.
Yeah.
I don't think you'll be getting on airplanes in July, so maybe next July.
Yeah.
No, but we outfitted this with 3 SolidWorks workstations, 3D printers, but standard pick and place line for making circuit boards, environmental testing. And one thing that's unique is what I'm in now is the EMC area, which is you can do all your EMC testing here, including FCC, CE, ICES, which is a big impediment. When you look to a young engineer, designing and building a circuit board and to do some function, that's great. It may cost a few $1,000s in parts and circuit boards and so on. But then they go to ship it or to sell it all over the world. You need all these certifications. And the cost for that are, here at CSA, it's $5,000 to get an FCC certification and $15,000 to get CE. They can do it here for free. And they do the test themselves, which is very beneficial because they can test beyond the limits and learn a lot about their product while they're doing it. So
yeah, so you had this foundation already in place, and now you saw this need in the marketplace and have sort of met it very quickly, just sort of putting stuff together. Is that fair?
Yeah, we have everything here. I mean, we have, we don't just 3D print here. We do mold making. We have injection molding machines. We have everything you need to make anything. And so, we have on track.
Talk about the process. I mean, day 4, day 5 of the 10-day adventure. What big hurdles did you reach? What happened? What was the process like?
Well, the first day was just doing a quick drawing of what it might look like, and then talking with a few doctors and getting some input about actually doing swabs from through a window. And that was one of the things that really was revised the most. The basic concept, that wasn't hard to come up with and finalize.
The interface between the medical professional and the patient needed to be carefully designed, right?
It did, and through trial and error, we would realize that it was the vertical axis that was where they needed the most freedom when doing a swab, not the horizontal axis. We originally started with round holes and ended up with a slot. And it turns out that you have to understand that this device is not in a benign environment, it's not a room inside of a building. It's a room that's out in the open air, so it's subject to wind loading and wind gusts and these sorts of things. And so we had to take extra precautions. And so we limited ourselves to 66 square inches of an opening. But the slot design is actually much easier to do a swab through. And it gives you much more protection from back pressure. A narrow slot gives you more protection than a round hole with the same area.
Like the air might sneak around the sides if it was a round hole. Yeah.
Well, no, that was just the center of the hole. It was more like a drum effect. So when we did the smoke test, we could see that there was a little bit of vulnerability when you had a circular hole in there, as opposed to a slot. So we went from a series of 5-inch holes to a 3-inch vertical slot that's 22 inches wide to accommodate various heights of individuals. And but through trial and error.
About the cost. What does it cost to? How are you selling these? And if people watching want to get one, what's the?
Yeah, they're very inexpensive to manufacture. So these are new sea containers, which they're all over Canada and the U.S. Yeah. You can get them for $3,000 or $4,000, and that's on the expensive side. The materials to make it, it's only about $8,000 or $9,000, but then you have your labor on top of that, another $8,000. So we are going to make a limited number of them here and sell them for $30,000. We're talking Canadian dollars here, by the way. So American would be $22,000. But what we're going to do is we're not going to protect this at all. We're actually going to publish all the information, the engineering information. If someone wants to copy it and make them, well, knock yourselves out.
Really? That's incredible. So you're going to open source it, here we're.
Yeah, well, I wouldn't say open source. We would release the information by request by a competent manufacturer. Okay. So if an American manufacturer says, hey, we can do this, we can make these, we will provide all the specifications, and they can knock themselves out and make as many of them as they want. So this is not a long-term project or a long-term company. This is a solution that was needed immediately for an immediate problem. Although, you know, it's going to last another year or so at least, because
Yeah.
not only is this suitable for testing for whether you have the virus, it'll be suitable when we're down the curve when we start doing antibody testing.
I'm trying to showcase just innovators finding challenges and then being creative and solving problems. I think North America has a ton of talent in that space, and you know, at times like these, it's important to celebrate, like point out what's really working. I know we have a lot of challenges, but there's a lot of things that are working too.
Yeah, there are, and there's a lot of people that have pitched in and helped out or volunteered for this project, and that's one of the reasons it was done in 10 days. And yeah, I've been overwhelmed with people offering support.
Yeah. So Tom, talk about the website. Like, where can people find more?
POSIStation.com. Okay. So there we have, well, you can see the actual prototype unit. It explains all the safety features of it. And you can contact me there if you like. And like I said, competent manufacturers. I mean, we're not just we don't want people building these in their backyards. If they're going to be built properly to spec, we'll help out anybody who wants to make them.
Yeah. Okay. Well, it's an incredible story and really a nice offer. I'm excited to see these in Nashville, where I live, and around North America, helping medical workers be safe.
Well, let's make that happen, Vic.
Yeah. Okay. Thanks, Tom. I really appreciate it.
Okay. Thanks, Vic. Cheers.